Good morning everyone. I am Pia Riptin from BPED 3B and I am going to continue the discussion of the group 4. Our topic is all about the types of hazards and here are the 6 types of hazards. Number 1, biological hazards. Number 2, chemical hazards. 3, physical hazards. 4, safety hazards. 5, ergonomic hazards, and number 6 is psychosocial hazards. Biological hazards. It includes viruses, bacteria, insects, animals, and etc. that can cause adverse health impacts that can range from skin and respiratory system irritation to the transmission of infection. For example, mold, blood, and other bodily fluids, harmful plants, sewage, dust, and vermin. Some biological hazards includes number 1, blood-borne diseases including HIV, hepatitis B and C, and malaria. 2, bacteria, molds, and fungi. 3, flour, milk, powder, or grain dusts. Number 4, other organic dust. And number 5, exposure to animals and vegetation. Chemical hazards. These are the hazardous substances that can cause harm. These can also result to both health and physical impacts such as skin irritation, respiratory system irritation or problem, blindness, corrosion, and explosions. Example: toxins, dangerous chemicals, residue of excess chemicals used in processing food products. Physical hazards. It is an environmental factors that can harm an employee without necessarily touching them, including heights, noise, radiation, and pressure. Example: electricity, fire, confined spaces, and extreme temperature. Safety hazards. These are hazards that create unsafe working conditions. Examples: exposed wires or damaged carpet might result in a tripping hazard. These are sometimes included under the category of physical hazards. Here are the 3 specific examples. Number 1, trailing power cords, loose or frayed carpets and rugs, spills, ice, and etc. This could cause slip, trip, or fall in the workplace and result in physical and mental impacts on an injured employee. Number 2, unguarded machinery. Unguarded machinery parts pose a safety hazard as employees can sustain serious injuries and fatalities if they were to accidentally come into contact with them. For example, clothes, lanyards, hair or body parts can become entangled in unguarded machinery, can result to bruising, broken bones, loss of limbs, head injuries, and death. Number 3, frayed and faulty cords, wirings, or cables. This could pose a risk of electric shocks, burns, and fires. Exposure to live electricity can also result in a fall from height. For example, if an employee sustained an electric shock while using a ladder. Ergonomic hazards. These hazards are a result of physical factors that can result in musculoskeletal injuries. Musculoskeletal injuries are those that affect the musculoskeletal system, including damage to muscles, tendons, bones, joints, ligaments, nerves, and blood vessels. Example: poor workstation setup in an office, poor posture, and manual handling. Here are the 3 types of ergonomic hazards. Number 1, manual handling. Lift, put down, push, pull, and carry objects but in a wrong body position and untrained individual, which can result to short and long-term injuries. 2, use of display screen equipment. 3, vibration. Long-term use of vibrating tools can have serious health impacts including vibration, white fingers, sensory nerve damage, carpal tunnel syndrome, and muscle and joint injuries. And the last is the psychosocial hazards. It includes those that can have an adverse effect on an employee's mental health and well-being. For example, sexual harassment, victimization, stress, and workplace violence. Number 1, harassment. It is the result of someone acting in a way that makes you feel intimidated, humiliated, offended, or otherwise distressed, and can have serious impacts on a person's health and well-being. Bullying behavior can result to a bullied individual to experience several psychosocial symptoms, including stress, anxiety, and sleep deprivation, loss of appetite, and sense of vulnerability. 2, workplace aggression and abuse. How to manage hazards in your workplace. Number 1, carry out an appropriate risk assessment for the nature of the work and the hazards. 2, introduce appropriate control measures. Once you have completed your risk assessment, you must introduce controls to reduce or eliminate the identified hazards. And number 3, appropriately train all your employees in their duties. All employees should have appropriate health and safety training or office safety training in addition to training for any specific workplace hazards. And that's all for our report. Thank you for listening.